Hi, my name is LThornton, and this is my health assessment video for Maryville University. This is my patient Casey, and prior to this exam, I did have her empty her bladder. I obtained her vital signs, her height, her weight, and I did test her vision using the Snellen chart for her distant vision and the Rosenbaum chart for her nearsighted vision. I've washed my hands, and we're going to go ahead and get started. First of all, I'm just going to do an overall inspection of her head. It's normocephalic. The eyes, ears, nose, mouth, everything is symmetrical. I'm going to go ahead and just start with the eyes. And just looking at her eyebrows are symmetrical. Looking at her eyelids and her eyelashes extend outward. I'm going to go ahead and look inside her eyes, or look at her sclera and her conjunctiva. Please look up for me. Sclera is white and the conjunctiva is pink, which is what we want to see. And it's good in both of her eyes. Please look straight ahead at a fixed point. Casey, I'm going to check your pupillary response and make sure that it is consensual. And go ahead and constrict and consensual. Constrict and consensual. Very good. We're going to do the cover-uncover test. I'm going to have you go ahead and cover one eye. Again, looking at that fixed point on the wall, and go ahead and uncover and cover your other eye, and then uncover. Okay, very good. I'm going to go ahead and use the ophthalmoscope for the red reflex test. Please look straight ahead. Okay, good. Okay, good. I'm also going to check the visual fields. I'm going to have you follow my pen light. Don't turn your head, only use your eyes. Okay, very good. Okay, I'm going to go ahead and move to your ears, and I'm just going to be looking at the outside of your ears. I'm going to palpate the auricle. Any pain with palpation? Trying to feel for any nodules, looking for any lesions. Everything feels fine. Any pain with that? I'm going to look at the anterior and posterior aspects of her ear and go ahead and look inside. Looking at the tympanic membrane, making sure that it is intact, looking for any signs of infection or fluid. Doing the same on the other side. Looking at the tympanic membrane. It is intact on both sides. It is pearly gray. I didn't see any signs of infection or fluid in either ear. I'm going to go ahead and continue with the hearing test. This is called the Weber test. This is a tuning fork. I'm going to strike the tuning fork, and please just let me know if you can hear this in both ears or just one of your ears.
Both.
Okay, very good. I'm going to do the same thing. Strike my tuning fork. This time, this is called the Wren test. I'm going to place my tuning fork on your mastoid bone behind your ear, and then I'm going to go ahead and bring it out on the side of your ear to test the air bone conduction. Okay? And let me know when the sound disappears.
Okay.
And again when it disappears.
Okay.
All right, same thing on the other side.
Okay.
And again. All right, very good. Going to continue with the Weber test. I'm going to go behind you. I'm going to whisper a word as you cover one of your ears. Go ahead and cover the right ear for me, and just repeat the word after me, please.
Apple.
Okay, uncover your right ear, cover your left.
Orange.
All right, very good. Your hearing is intact. That's good. And I'm going to go ahead and move forward. Looking at your nose. Go ahead and lift your chin for me. I'm looking at the septum, making sure that it is midline, looking for any nasal drainage or polyps or nodules. I don't see anything there. Looking at the turbulence is intact. Everything looks good. I'm going to have you go ahead and include one of your nares. Take a deep breath in and out. We're just checking patency. And the other side, same thing, in and out, checking patency. All right, moving to your lips and your mouth. Your lips are pink, they're moist. I don't see any cracks, no lesions. Let's go ahead and look inside your mouth. I'm going to go ahead and look at the buccal mucosa. Looking at your tongue, it's pink, it's moist. Looking at the hard and soft palates, looking at your teeth, looking for any cavities. Everything looks good. Stick your tongue out and say ah for me.
Ah.
The tonsils, the pillars all look very good. Everything is intact. I'm going to go ahead with checking your gag reflex now. Go ahead and open your mouth again. Okay. Very good. And then we're going to continue with some cranial nerves. Okay. So I'm going to have you again stick out your tongue and have you smile for me. Clench your teeth. Puff out your cheeks. Squeeze your eyes really tight and wrinkle your forehead for me. Okay, good job. And those are some of the cranial nerves. I'm also going to have you close your eyes. I want to test sensation and just let me know if you feel this.
Yes. 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 Yes.
Okay, very good. All right, I'm going to go ahead and palpate now. I'm looking at your hair, the distribution of your hair. I want to go ahead and touch it and see if it's fine or coarse. I'm going to palpate for masses. Do you have any pain with this?
No.
Your scalp moves freely over your head. I'm not feeling any bulges or masses or seeing any lesions of concern. So everything looks good there. I'm going to continue to palpate your facial bones. And then your sinuses. Are you feeling any pain with this?
No.
Okay. Any pain or tenderness with that? All right. Okay. So then from there, I'm going to inspect your neck. Oh, actually what I wanted to palpate was your lacrimal apparatus here. That's what my hesitation was. That's what I was forgetting. And any pain with that? Okay. Moving on to your neck, I'm going to have you go ahead and just look straight ahead. I'm looking for any bulges. I'm not seeing any pulsations, no neck vein distension, no jugular vein distension there on either side. I don't see any pulsations. I'm going to have you just go ahead and move your neck up and down, checking range of motion side to side, and bring your shoulder to your ear on each side. And any pain with that. I'm going to go ahead and check your muscle strength and resist. Okay, very good. All right. So I'm going to go ahead and continue and palpate for carotid pulse, both sides. Okay, checking that your trachea is midline. I'm also going to palpate your thyroid. Feeling for any nodules, please swallow for me. Okay, very good. And I didn't feel any nodules there either. And I'm going to go ahead and palpate your lymph nodes. And you're going to start in the pre-auricle area, go to the post-auricle, to the occipital, up to the tonsillar, submandibular, submental area, down to the superficial carotid or superficial cervical chain, posterior cervical chain, and deep cervical chain, and the supraclavicular area, and then also bring your arms out for me, Casey, the axillary area. And did you have any pain or tenderness with that? I didn't feel any bulges or inflamed lymph nodes, so that's good. All right, I'm going to go ahead and listen with the bell of my stethoscope. I'm going to have you take a deep breath in and hold it, listening for a bruit. Okay. And again, hold your breath, please. Okay, and then I'm going to go ahead and just listen to your thyroid. Okay, good. go ahead and move down to your chest. Actually, no, let's do your extremities first. So go ahead and do your upper extremities. All right, I'm going to just look at the muscle mass on both sides. It is even, your skin is warm, it's dry. I'm going to look at the hair distribution. That is also even. I'm looking at your nails. Your capillary refill is less than 2 seconds. I don't see any cyanosis. Also looking for any suspicious moles or lesions or protrusions. I don't see anything on your skin, so that's good. I'm going to go ahead and feel for your brachial pulses and your radial pulses. Okay, I'm going to go ahead and test your reflexes. Brachial, radial, this side, the brachial and radial. Okay, good. Now I'm going to test your strength. Please put your arms straight ahead and don't let me push your arms down. Don't let me push them up. And bring your arms out to the side. Again, don't let me push down. Don't let me push up. Okay, very good. Please bring your legs over the edge here. Looking at your skin, it is warm, it is pink. Looking at, again, hair distribution. I don't see any edema, I don't see any varicosities. So everything looks good there. I'm going to go ahead and check your popliteal pulses. And then your dorsalis pedis pulses and your posttibial pulses. And those are normal as well. I'm going to go ahead and check your reflexes. I'll need you to come forward just a little bit here. Okay. All right, very good. Let me just bring the leg up here. And bring your other foot up for me. I'll hold it. Okay, very good. And then we're just going to test strength. Go ahead and push up on my hands if you can. And push up, bring your, kind of flex your feet for me. Good, and push down. Okay, very good. Everything looks good there. So, we're going to go ahead and move on to your chest now. I'm going to have you go ahead and turn around. We're going to start with the posterior chest. And with this, I'm just looking at, again, looking at your skin. Looking at your rising and falling of your chest, your respirations are not labored, your chest is symmetrical, and the rate seems to be within normal limits. Looking at your skin, it's warm. I don't see any protrusions or lesions. I'm going to go ahead and I'm going to perform what's called tactile fremitus. I'm going to put my hands over your chest, and if you could please just say 99 as I move my hands down.
99, 99, 99, 99.
And the vibrations are equal on both sides. When I did that, I'm also going to test expansion. I'm going to place my hands at T10, and I'm going to be watching with my thumbs as you take a deep breath in and let it all the way out. Okay, very good. And I'm also going to percuss. Okay, and I'm going to do diaphragmatic excursion, and what I'm going to do is I'm going to continue percussing down, and I need you to go ahead and take a deep breath in for me and hold it. Okay, just listening for go ahead and breathe, Casey, a change in that tone. I'm going to put a piece of tape here. And I'm going to go ahead and percuss up. Deep breath in, let it all the way out. Okay, very good. And we'll go ahead and place a piece of tape there. Same thing, other side. Please take a deep breath in and hold it. and breathe. And then I'll have you take another deep breath in, let it all the way out for me. Okay, very good. And then I'm going to go ahead and listen to your lungs. Take some deep breaths for me. Okay, very good. All right, I'm going to have you go ahead and turn and face me. I'm going to continue with the anterior portion of your chest. I'm looking for any heaves or thrills, looking for any pulsations. Again, any lesions or anything, everything looks good. I'm going to go ahead and just feel for heaves or thrills. And then I'm going to have you say 99 again.
99.
Okay, please lift your arms up. 99.
99.
Okay, and that is equal on both sides. So I'm going to go ahead and listen. To your lung sounds. Take some deep breaths. Okay, listen on the side here. Okay, very good. I'm going to go ahead and continue. I want to listen to your heart sounds. Okay. I'm going to listen with the bell of my stethoscope. Actually, I'll just use the diaphragm. And the aortic. Pulmonic. Herbs. Tricuspid. And the mitral. Okay, we'll go ahead and have you lay down on your back there, and I'll need you to go ahead and lift up your shirt for me. Let me get my pen light and a pen. Go ahead and lift up your shirt. And I'm going to just inspect your abdomen. Looking for any pulsations. I'm going to go ahead and utilize my pen light here. Any movement or pulsations in your abdomen, everything looks fine while I look here. And I'm going to go ahead and just listen to your bowel sounds. Your bowel sounds are active in all four quadrants. I'm going to go ahead and continue to listen, and I'm listening to your arteries. I'm starting with the aorta and the renal. And the iliac. And the femoral. And then I'm going to go ahead and percuss. Any areas of tenderness at all in your belly? Okay, and I'm going to percuss and locate your liver border. Listening for change in sound. Okay, I'm going to go ahead and mark that with my pen. And then with the spleen. mark that as well. Okay. Now I'm going to go ahead and palpate. Just light palpation first. Any tenderness with that? And I'm going to go ahead and deep palpation here. Feeling for your liver. Have you take a deep breath in for me, blow it all the way out. Very good. Okay, I don't feel your liver, which is good. We don't want to feel it. And again, deep breath in, all the way out. Okay, good. I'm going to go ahead and palpate for your kidneys. Deep breath in, all the way out. Okay, and this side, same thing. Deep breath in, all the way out. Good. Okay. I'm going to go ahead and just feel for a pulsation in your aorta here. And that don't feel anything there, so that is negative also. Okay. And that does complete the abdominal for the assessment of your abdomen. Okay. I'm going to have you go ahead and come up here, Casey. I have just one more thing for you today. I just want to check your lower back and your flexion. Okay, actually have you stand right over here, make sure the camera can see you. Please go ahead, bend down, touch your toes for me, and flex backward for me, and then rotate from side to side, to the left and to the right, and then bend laterally on each side. Any pain with any of that? Okay, wonderful. That does complete my assessment video. I'd just like to thank Casey for allowing me to assess her.